strange voice, but you get what you pay for. And then you can do yoga. You could do anything to your tolerance. So if you're really exhausted, you shorten your workout. One thing that they did learn, stress can lower a lot of those cortisol hormones, but it also increases cognitive function. It increases the growth of new blood vessels. It increases the production of neurons. So when we talk about dementia, and I'm going to talk about diabetes and heart disease, we know that exercise is beneficial. Sleep, my favorite. Forget exercise. Let's just sleep. This is interesting because sleep, a lot of the new current literature, I tried to give you as much as I could that is current and new. What they have found recently is that sleep, they thought that if you had at least 6 hours of sleep, you were doing good, everything was fine. But now they've actually learned that if you have sleep between the hours of 10 and midnight, those are the most restorative. Not just the first 2 hours as they thought before, but now they realize it's 10 to midnight. That helps with that circadian rhythm to restore that back into its normal cycle. The other thing that they learned is anything less than 6 hours increases the inflammatory markers in patients almost 100%. So less than 6 hours, even if you pop out of bed and you feel awake and alert and yay, the day's going, it's probably driving up those inflammatory markers. I'm just reiterating the exercise point one more time. Here's that circadian rhythm with the cortisol and that nice little sinule type wave that you see there. That's in somebody that has a healthy cortisol response. It tends to raise in the morning about 5 or 6 a.m. And everybody wakes up, you have a little bit of energy, you're a little bright and alert about noon, and then somewhere around 1, 2, or 3 it starts to drop again. Some poses it really drops and you need a nap. And then somewhere in the evening, it starts to, again, go down and get you ready to go to sleep and so forth, and it starts over again. So that's a normal, healthy cycle. These are some dietary foods that you can actually eat that actually do modulate cortisol. Greens, everybody always hears me say greens. I don't know, some of you remember me driving home greens. But greens, yes, they do. They are very loaded in B vitamins, also in zinc and magnesium, which we know help modulate cortisol. Omega-3s, walnuts especially, any nut that's shaped like a brain, good for the brain. So just remember, nut, good for the brain. Dark chocolate, my favorite. And of course, lean grass-fed meat. So everybody asks me, meat good, meat bad. Interestingly enough, the information is grass-fed meat, no hormones, no added, they get to walk around, has much higher levels of omega-3 and a lot lower levels of omega-6, which is inflammatory. And we get a lot of omega-6 in the meat that's fed grain, lots of grain, because that's high in omega-6. And so that's very high in inflammation. So grass-fed meat, in moderation, it's great. This is just another picture showing you how much cortisol can influence not just the immune system, but also the cardiovascular system and the neuroendocrine system, all of the systems. It has a key role in modifying all of them, lowers immune system function, inability to optimize its function. Cardiovascularly, all kinds of things happen, so just driving that home as well. One of the tools that we use a lot at Cleveland Clinic that I learned about when I was there is called a heart math tool. It's a biofeedback tool that is available to the lay public. Pretty inexpensive. It's about $100 for the apparatus. You plug it into your smartphone. I always laugh because I don't feel smart with my phone. But anyway, plug it in. You plug it into your smartphone, you clip it to your ear, and what it's doing is it's measuring the fight or flight mode, that sympathetic system, from beat to beat. So every heartbeat that you have in between that beat, you get input from the nervous system that either says relax, digest, and heal, or run from the bear. And so if you're constantly seeing that you're running from the bear, what it does is it actually teaches you. It says, oh, you're in the red zone, Aunna. You need to bring it down to the green zone. And so you can watch it and deep breathe until it comes to the green zone. And their outcomes are based on 3 minutes, 3 to 4 times a day. 40% reduction in stress levels, almost 50% reduction in fatigue, and most of our patients say the biggest aha moment for them is sleep, and their ability to think and reason through the day. Probably because they're sleeping better is my guess, but just some really neat outcomes. So for a very inexpensive tool, this thing has been very profound. Great for anxiety, by the way. Remember, food. Let food be thy medicine, but it also can be your poison, so choose wisely. Not only is it good, as you're going to hear all day today, for preventive disease, preventing and reversing disease and controlling disease states, but also, what if you already have it? What if you already have something? Is it going to do anything to stop it or change it? One of the most profound studies that I know of was the prostate cancer study that they did, where they showed the DNA actually being changed by diet within just a few weeks. So what they did is they had a group of men with prostate cancer, actually pretty large group of men, and they took those patients, checked the DNA, and you see the cells. The red cells are cancer cells, the green cells are normal. The pre-dietary change, what they did is they increased their diet intake to predominantly vegetable intake. They had 80-20 is about what it was. And then afterwards they checked their DNA, and you can see a very big difference. Can you all see that? Appreciate more red, less red, better off afterwards. Awesome study. So I'm kind, I'm gentle, but I'm also kind of a pain in the rip. It's your own responsibility to be well as you possibly can be. We have to be accountable for what we do. Nobody is forcing you to eat whatever you're eating. Nobody is making you stay in bed in the morning and not exercise. Nobody is doing that to you but yourself. I know your lifestyle is busy. I hear it all the time. I'm so busy. But I get up at 4:45 or so in the morning, and I exercise. I drive an hour now to work. Ugh. I work, and then I drive home. So it is all up to us to do the best we can with what we have. It's your deal. No more passive patience. I told you I'd talk a little bit about oral health because actually part of our screening has to do with this. And when I see patients that present with arthritis and inflammatory conditions, chronic fatigue, one of the things we test for are viruses and bacterium that can be in the bloodstream. But we know that a lot of them come from the mouth. Mouth health, yes. So we start there. It affects everything from diabetes, heart disease, arthritis, but also even lung disease, which I think a lot of people are surprised when they hear that. What happens is you can get bacterium from, say, diseased gums, or even just bacterium that are hanging out in the mouth that sort of get to this overgrowth state, which is why when I talk about probiotics can be very beneficial for oral health. But you get this bacterium, gets into the GI tract. If your GI tract is somewhat unhealthy, or say you have gastroenteritis or tummy bug, or you take some Pepsid, then your barrier, your protection in the GI tract is not as optimal, and so you get some leaky gut. So you get some of that bacterium that trickle into the bloodstream. The bloodstream and the vessels itself respond to that bacteria, and it creates a little bit of inflammation because it's not supposed to be in the vascular system. And so then it says, wait, hey, calling all cholesterol. So they come to the rescue, put a little bit on the wall to protect it like putty, and then all of a sudden several clumps fly by because we ate a lot of saturated junk food and bad stuff and a lot of sugar, and then now we have plaquing on the clump that was supposed to be protective, and so now all of a sudden we've got plaque in the artery from the bacteria that came from the mouth. And then circulating through, one of the biggest areas of exchange of our oxygen and blood is in the lung. Oh darn, the darn bacteria is now in the alveoli and we have a lung infection. Amazing. So instead of separating each part, it's really been fun to put it all together, and that's what we do. We put all the systems together. This is another one with same idea, looking at the artery, the vessels. Oh, also driving home the point that there's a lot of connection between the bacterium and the infection in the gums, and the gum health, oral health, and obesity. That's kind of where the current research is headed. They're really focusing on bacteria, good and bad, and weight gain. It also affects diabetes. It upregulates those cytokines, those messengers, the traffic lights, the signals that are to the inflammatory system, and they say, hey, there's a problem here. As it increases those inflammatory cascade of hormones and so forth, then all of a sudden our cells get insulin resistant, and then, God darn it, 5 years later, the doctor says, hey, you got diabetes. Brush your teeth. Go to the dentist. The next thing is not just affecting elderly patients or older, more mature patients, but what about the young? What about the new pregnant mom? We know that it increases low birth weight, and we know that it increases preterm labor. So dental checkups before you get pregnant, ideal, or even in the early part of your pregnancy. Highly recommended, and we recommend it regularly to our patients. Here's something I learned. Second leading cause of oral health disease, sleep, lack thereof. Less than 6 hours of sleep, same principle, driving home the point that it is all about the inflammation and tied to our lack thereof of sleep. How do cavities happen? Well, we all know how this happens. At least our mom told us. You eat sugar, the sugar get to the bacteria like the sugar, they feed on it, they produce acid, the acid denatures the enamel, and then all of a sudden we have cavities, gum disease, and now we're going into the doctor because we suddenly developed arthritis, my joints are killing me, oh, why do I have this funny cough? You see how it all starts to, one after another. So the first chronic disease that I'm going to talk about is diabetes, because I keep honing in on the insulin resistance. So type 2 diabetes makes up 90% of all diabetics in the United States. 10% of it is type 1, which is a genetic type of diabetes. Most of it is a lifestyle modified diet. Most of it is a modifiable disease, type 2 diabetes that is. Oftentimes it leads to diabetes being diagnosed now instead of just to adults. It is now seen as early as 12 years of age. It used to be only an adult onset type of disease. We've taken that out of the definition, and it's mostly, it includes even children as low as 12 years of age. Usually ends up costing a lot of money, especially when it comes to your medications. But ultimately, the biggest concern for most of us should be the fact that 44% of new kidney disease is due to diabetes. Over 60% of your amputations are also due poorly controlled to diabetes. So unless you like to lose your limbs, I would say let's take heed to what we're learning and let's implement as much as we can. Ohio State, since I'm in Ohio, I thought I better put something in from Ohio. Did a really great study looking at pre-diabetic or insulin-resistant patients in 2014, but what they wanted to know was there a relationship between the fat intake they had and their obesity with these pre-diabetic patients? Or was it really just about the sugar, or was it a combination thereof? So what they did is they took two sets of people and they said, you over here, you're going to eat a very low-fat diet, high sugar or carbohydrate diet. So they took them from 50 grams to 350 grams of sugar a day, and they said low fat. This group over here, they said just the opposite. We're going to give you a ton of fat, and we're going to keep your grams of sugar down in the 50-gram range, the lower range. And so what they found out was actually the people that they ate a ton of fat actually had lower amounts of serum saturated fat in their blood. They had the lowest amount. The people that had the highest sugar intake actually had the highest amount of fat, cholesterol, bad stuff floating around in their blood. So that was an eye-opener, kind of in lieu of the investigation that they're doing with the whole fat conundrum that we're going to get to here in a second. Oh, it did stay there. So we were having trouble with the slide. So sugar. You know that song? Sugar, sugar, bum, 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 oh. Yeah, you do know. Good. That's the one. That's the only time you should be talking about sugar. Okay? Just kidding. I like this study. We know that it causes inflammation. We know that it can cause a lot of arthritic conditions. We know that it can cause and perpetuate disease. But this was really interesting because they actually looked at specific things that you could eat or be exposed to that raised inflammatory markers in the blood. And the interesting thing was, we all know pop. Yeah, we know. Diet pop? Mm-hmm. Processed meats? That was an eye-opener. Interesting. And so forth. So those were interesting. Refined grains also. But the cool part was they also looked at coffee. Not so much. Didn't raise the inflammatory markers in moderation, mind you. My dad and I had this talk yesterday. Where's Dad? A pot, not so much. Cup or two, okay. And then also maybe a little glass of wine. A lot of veggies, of course, were very beneficial, did not lower CRP levels. Even the starchy vegetables, the yellows, the squash, the potatoes, but most of us think that's going to raise inflammatory markers. They actually did not. And that's been repeated several times. So I always say, let's just stop the madness. Stop the madness. You get a little weight gain, the fat tissues create a powerhouse of inflammatory signals called cytokines. Those cytokines then increase more inflammatory markers, makes our cells less resistant to the insulin. Oh my gosh, you can see the vicious cycle. It starts getting crazy, and then we've got scribbles all over the paper, and that's a mess. Then we end up here. This is scary. My beloved county is right up in there. You see where Oklahoma is? You see where we are? You see that bright red or dark red? We don't want to be that color. So basically what they're saying here is they're looking at adults greater than 35, death rates associated with heart disease. We don't want to be the winner of that category. What they have said is that we are in the range of 400 to 1,000 deaths per 100,000 people. Ugh. Horrible, horrible statistics. So when you look at heart disease, cost of heart disease, how can we control it? How can we prevent it? The big eye-openers, I think, for me is bypass surgery, by the way, is life-saving and amazing surgery when you need it. The problem is it's not the answer to the problem. 3% bypass surgery prolongs life less than 3%. That's not really good odds, right? Also, you can change and prevent another occurrence by lifestyle modification by a lot. Studies recently, when they started looking into cholesterol and heart disease, this has been like the biggest aha. So those of you that got the books, and by the way, I have 2 books that are autographed. Oh, and I have to go back to the intro. So Dr. Hyman cracks me up. But anyway, he calls me Aunna all the time because we have 2 personal assistants in the office. One is Aunna, and the health coach is Aunna that he's worked with for 20 years. So he calls me Aunna at every meeting, and the whole group says, "It's Aunna!" And he goes, "Aunna." So halfway through, I noticed he threw in an Aunna at the end, and I laughed because I sent him a text and said, "Aunna?" And he goes, "I'm so sorry." But we had recorded that like 3 times, so we took it. So we went with it. But anyway, side note. But what they've done is they started looking at cholesterol and its relationship to heart disease. And this is pretty interesting. I don't know if you guys realize that most people that go to the ER that actually have a heart attack, not that go and you have the chest pain and then they send you home, but that actually had a heart attack, had normal cholesterol. They've known this for several years, and it's kind of spurred the investigation that nobody really wanted to talk about because we've done something for about 30 years by driving fat out of the diet and lowering cholesterol and saying that's the cause of heart disease, and it's really difficult to change that thinking. Well, we know now that 75% of the cholesterol and fat that's made is made in the body. The rest of it is instigated by alcohol and sugar. Darn. No margaritas, just kidding. And some other interesting facts is this. So they did several studies in, let's see, I have to get the details exactly. The British Medical Journal Review and the Journal of Clinical Nutrition in 2014 went and they did a retrospective study of all of their articles on heart disease and cholesterol, and they found no correlation between fat and heart disease. Uh-oh. This is 2014. The next thing that happened is they said, holy crud, we've been lumping all of this heart disease and all of these so-called fats as bad into one big giant lump. That's not good. Because there's actually only two that are bad: palmitic and stearic acid. After Dr. Chowdhury took a look at 72 most top journals, respected journals that had to do with heart disease and fat, he found the same conclusion that they found. And he said, but really what's driving it are these two guys. And so then they dug into, why is it just these two guys? Well, what happens is when you eat sugar and when you drink alcohol, although alcohol not as much as sugar, because alcohol doesn't give you such a high spike of insulin unless you drink a lot of it. So a tiny bit of alcohol was not the issue, it was a lot. But sugar immediately causes the production of these two guys. And these two types of fat start that whole inflammatory cascade. So that is kind of the take-home message from what they've learned thus far. What they have learned also is that high levels of carbohydrates with those two bad fats and low levels of omega-3s is the problem. So if we have actually high levels of omega-3s in our diet or in our body, it actually offsets some of that inflammatory cascade. So we have the power to find a good quality fish oil or eat a lot of fatty, salmon and sardines of good quality and actually offset some of that inflammatory issue. So 2015, one more year later. Yay, I love that, right? We're just gonna eat butter. You're just kidding. Probably not a good idea. Moderation is key. 2015, the Dietary Guidelines Advisory Committee. Wow. So they sat around and they said, holy crud, since 1983 we have been telling these people to eat low fat, and we have been wrong. What are we going to do? So what they did is they got together and they said, I quote, evidence shows no appreciable relationship between the consumption of dietary cholesterol and serum cholesterol as consistent with the conclusion of the American College of Cardiology and the American Heart Association Task Force report. Cholesterol is not a nutrient of concern for consumption. Wow. So, guess what's coming down the pipeline? Statin questions. Shh, talk about that. The next thing that I say related to heart disease is the cost. We keep talking about cost, and I don't want any more taxes, but if you don't have any idea how much it costs for one stent to be placed, it's about $50,000 for one stent. If you have 2, 3, 4, which is common, one bypass surgery is $100,000 per person. This is not an annual, everybody dips into the pot. This is per person. This is a pretty notable expense to people out of personal pocket. It's not a government pocket kind of issue. So I thought that was a pretty big deal. The next disease I'm going to mention is osteoporosis. It's called the silent disease because we don't usually know that we're having bone loss until we have a fracture or until you have a really good physician that maybe sends you for a DEXA scan. But it affects both men and women. And I think a lot of times we're leaving out the male population, which is a sad disservice. But basically, what happens is you get bone breakdown and bone loss, but what's driving it? It really goes back to, I'm going to give you guys one guess. Oh, yeah, well, yeah. Inflammation, which has probably come from the sugar. So yes, sugar. This is just an example of what we've been talking about, the food that we eat and how it just perpetuates that cycle. They know that bone now is not just a structural entity. It actually affects the metabolism, and it affects our endocrine system, and it affects our inflammatory system, and it helps regulate and neutralize pH imbalances. Your bone is an active participant in your health. Here is your bone on Coca-Cola. Not a good picture. So the phosphoric acid in most soda pop is part of the problem. The sugar also a problem. Leaches out some of the calcium. It can't and it borrows a lot of, it has to use calcium to neutralize the pH from the phosphoric acid and so forth, and that's just a very yucky cycle we get into. Again, same thing, I'm driving home the point of the inflammatory cascade related to bone. Let's talk about our brain. Cognitive decline kind of lumps all of them together. Dementia, Alzheimer's, Lewy body disease, Parkinson's, neurodegenerative diseases in general are a hot topic because nobody wants to go there. We often are affected, either ourselves or a loved one. The statistics, 5.4 million as of 2015. I actually have a new statistic as opposed to up there. 2015, 5.4 million Americans are afflicted with Alzheimer's. Of those, because they thought it was only, a over 65 disease issue, over 200,000 in 2015 had the diagnosis of Alzheimer's, and they were under 65. Other things that are kind of daunting, every 66 minutes, somebody is diagnosed with the disease. Nope, scratch that. Every 66 seconds, someone has or develops the disease. Sorry. One of the top 10 leading causes of chronic disease, debilitating disease, and mortality is dementia and Alzheimer's. The projected cost, current cost, is about $200 billion or